Okay, this is a syringe of water. I just had Banamine in it for Bobby because she had an injury. We're going to go over there in a second. This is a 1-year-old Mustang. Okay. Not scared of a syringe, can squirt water right in her mouth. No head throwing, nothing. I've refilled the syringe with water again. 4-year-old Mustang. Gently approach. Go with the water. Squirt the syringe. There's movement. There's freedom of movement. There's no fear of the syringe. He's completely fine. Now let's go over here. Okay, I've refilled it again. I've had Bobby her whole life. She's already running away from me because she sees the syringe. Okay. She just went to a hospital overnight. She has never thrown her head. She has never run from a syringe. She's never done anything. I've dewormed her. I've given her medicine. I gave her Banamine, which tastes like absolute crap, before she went to the hospital. Watch this reaction. I'm livid with how they've traumatized my horse. Watch. Running away, ears back. Okay, if I grab a hold of her. Whoa. Whoa. Turning her butt to me, telling me she doesn't want it. Knows what I'm doing. Has fear and trepidation. Okay, I have a hold of her halter. Throwing her head. Pulling away. I've just worked with her for 30 or 40 minutes, so it's a little better. Trying to bite me. She's trying to run me over. Whoa. Whoa. Throwing her head. Throwing her head. Give a release. Trying to break this trauma cycle in her mind. Licking and chewing, I'm going to give her a little bit more space because that was the right answer. Okay, when you force horses who are scared, not give them a choice, they have trauma responses, which makes them quote unquote dangerous. She is not dangerous. She's trusting me right now, but she's telling me I don't like it. I never had this problem with her. Whoever handled her in the vet office created this issue. It's okay, Bobs. Even with my finger. Pinching her mouth shut, won't let my finger in. Let my finger in, but throwing her head. So we're going to do this until she stops. She relaxes. She's trying to get comfort from me. She doesn't like it. I know she doesn't like it. As soon as the syringe comes in, we do it again. Okay? Because we have to. It's okay for her to express she wants to walk away. We're going to walk with her and gently ask her to stop. Whoa. When she listens, we release pressure. It will take me several times. This is water. There's not even a smell. Okay? She's relaxed. She's thinking, but I have to follow through on some of it for her to realize that we need to do this and it's okay. Okay, as soon as she relaxes, we've got this here again. Rub it on her face. Let her walk it out. Little bit of pressure so she's not completely running me over. Rub it on her face. Let her think about it. She stopped on her own without me putting pressure. And the cluck is the right answer for her for release. So they taught her to fight, throw a fit, corner herself, and try to kick people. Look, I'm not even close to her. She said she doesn't want it any closer than 4 inches from her face. So, whoa. So I'm going to respect her boundary and leave it there. That's her release. She won't even look at it. As soon as I enter that barrier she created, throwing her head again. She relaxed. I'm going to release. Okay, I've already worked with her, so I just wanted to show you guys what was happening. I'm going to release her and let her go and squirt the water out. She's never had any fear of any of this before because I've handled her myself and I've trained her and she trusts me and I give them release when they choose to follow me. So they're choosing to obey, they're choosing to follow. This is a trauma response because they violated her as a being. She said, no, I'm scared. And they grabbed her. They did whatever they did. They shoved something in her face. And I'm sure, because I know her, she's strong-willed. She probably ran around the stall. She may have kicked somebody. I don't really care. You shouldn't be handling a horse in a hospital situation, no less, that you cannot calm yourself, be patient, and approach her with calm confidence and wait until she's okay. She's never thrown her head ever. So they must have gone in thinking she's going to be aggressive and aggressively treated her. So now I have to untrain this trauma response in my horse that has never had this before.